Hello, everybody. This is Lieutenant Governor Matt Pinnell with another episode of our Okla Proud interview series. Just interviewing great Oklahomans that are doing really important work through this crisis that we are in. And today I'm really excited to kind of introduce you all to Dr. Hannah Swallow, who is a clinical psychologist focused, really her focus and expertise is with children and families. And I'm going to let Dr. Swallow introduce herself, but clearly those that may be watching this or listening to this that have children in the home or family situations, this is unprecedented what we're dealing with right now. And we wanted to make sure that we brought someone that had an expertise in this to kind of speak directly to you and give us some pointers on ways that we can get through this with a healthy family unit when we come out of this, so that Oklahoma is stronger to recover from it. So with that, Dr. Swallow, thank you for being with us this afternoon, and tell Oklahoma a little bit about yourself and your background.
Well, thank you for inviting me. I'm really pleased to get to join you today. As you said, I'm a clinical psychologist. I'm in private practice in Edmond for about the last 15 years. I work primarily with children and adolescents and their families, but with the full age span, and I do assessments and evaluations as well as therapy.
Excellent. So we'll just get right into it. How should we talk to children about this situation? And that can certainly, you can expand on that as much of it, but really, how should we really be talking to children through this crisis?
Well, as you said, it really is unprecedented. And so a lot of how we approach it needs to appreciate not just that it's unprecedented for our kids, but that it's unprecedented for us. And so it's really understandable that we feel unsure and a little bit overwhelmed sometimes about coping with it for ourselves, and then how to help our children manage it as well. There are two things that I think are really helpful to consider when we're deciding how to talk to our children about the COVID situation. The first is the age of the child that we're talking to, and the other is any particulars about that individual child's needs or personality or style. In terms of age, our youngest kids really just need to know that they're safe and watched over, and that grown-ups take care of grown-up things. So our youngest kids up through early elementary years really don't need to have a talk about a virus or germs or things like that. When they ask questions that put us into dealing with the impact of this, for example, can we go visit grandma? They really just need an honest answer, which is no, not this week, but we'll see her later. When we get into elementary age kids up through late elementary, they need a little bit more of an age appropriate discussion about acknowledging that they're hearing about things, that they know that there's a virus going on and that people are being careful. They really just need concrete answers to their questions. So if they ask a question, you need to answer it, but without raising anxiety. So we don't need to say things like, for example, we can't visit grandma because we'll get her sick. But instead we say,
yeah, I'm hearing a lot of that, and people kind of jokingly said, no, we can't go visit grandma and grandpa because they're old. You know,
right,
and old people get really sick right now. And people have kind of been jokingly talking about that. But yeah, I was like, that seems a little harsh. And so those are some very good pointers when it comes to that.
That's such a great example of where our own anxiety can sometimes leak out into how we're talking about things with our kids. And so it's good to do a little thinking ahead of time and know, okay, for my kid in this younger age range, talking about their grandparents being old or not being able to get sick raises more questions and more anxiety than it does comfort. And so just being direct about that's not something we're going to do now, but we'll do it when the time is right, is reassuring to kids, but it also isn't false. When we get into middle school age, again, we need to answer the questions that are asked, but just the ones that are asked. So we don't need to get ahead of our kids or bring up new things that we've heard in the news that we think would help them understand the depth of the situation. We're really following where they're at. Adolescents, when we get into our teenagers and high schoolers, they have access to so much information, and they, in many, I don't know about your family, but they're often ahead of us in terms of just hearing what's going on in the world. And so we can have more open and thorough conversations with them. And we can anticipate that their questions are going to require us to talk more in depth about what's going on. We still need to follow where they're at and not get ahead of them and offer more information that's anxiety provoking than is useful. I think with our teenagers, one of our best roles is to help them in figuring out how to manage the information that they're taking in. So the understanding that quality and quantity matters. Get your information from reputable sources, and don't let it just be flushing through your brain all day. Get some information and then go do something else. Watch a movie, read a book, spend some time with friends, do other things that are healthy, good, stress relieving things. And when you go back to gather some information, make sure it's with a reputable source.
Very good.
I'm sorry. The other thing was the idea that kids may have some individual needs. So beyond gauging what you say for what your child's age is, being aware, is this child, just by personality, a more sensitive child who perceives and reacts to things in a quicker way or in a more dramatic way. Engaging or calibrating what you say to that child is important. It's also important to think about if our child has some pre-existing mental health issue or developmental issue. We want to be sensitive to that. And similarly, if our child has a history of trauma, then discussing anxiety-provoking things in a way that is sensitive to the fact that they may feel it and may process it differently is really important. Also be aware, and I've run into this with a number of families, if your family has gone through a number of things already in the last few months or year, be that the loss of a relative or significant marital strain, the death of a pet, a big move, know that this stress is one of many, and be aware that your child's coping resources may already be a bit depleted. And so meet them where they're at.
That's very good. That kind of led into my second question of how much is appropriate to share. I think you answered that, but any other points that you would want to, again, reinforce? I loved it how you broke down the age ranges there, and really managing the information with adolescents and teenagers, I think is very smart right now. But how much to share as far as what the level of what's appropriate right now?
I think your best guide really is how your family typically talks about things, what you know about the way your child processes information, and keeping your mind on those two principles. What is the age of my child, and so what's reasonable to expect them to process, and what are the individual needs and just particularities of my kiddo, so that I can speak to where he or she is at.
That's good.
Yeah, those would be the general themes, I think.
What are some little things that parents can be doing right now to try to have some normalcy at home right now with what's going on?
I think one of the biggest things is sticking to some routines. I and my colleagues have talked often with each other in these last couple of weeks that we keep coming back to this with folks, that keeping a sense of routine in our families' lives is very, very important. Probably even before that is for us adults to manage our own anxiety so that we can execute those routines in a way that feels normal and reassuring to our kids. The routines range from things like just the everyday, how we do wake up and breakfast, what our bedtime routine is, how much we watch screens versus do other things, chores. Keeping those things regular is really reassuring to children. When you think about why routines exist, picture a classroom you've walked into or a day camp for kids. They often have a schedule. They have literally a poster. Here's what we're going to do today. That's because routines provide a sense of predictability and control. And for children, what predictability and control is safety and security. So where we can use those routines to maintain our family's normal rhythms, it's a really useful thing.
Yeah, that's good. So really, I mean, that really answers the question of what we can be doing to help kids through this process. Those routines are right at the forefront of what you would be telling any family.
Mm-hmm, definitely. Other things that can be very useful that we just know are really healthy stress management strategies that really any of us can make a part of just a daily practice is some physical movement. It sounds, you know, we should all be exercising, but it really does help us to, our bodies and our brains to process stress and to cope more effectively. So especially rhythmic activities like running or dance or jumping jacks, biking, those sorts of things are really, really good for us. Adequate sleep and good nutrition are always helpful. And everybody says it for every situation, but really when you're coping with stress and your brain is bathed in more stress hormones than typically, it's a really good idea to pay attention to those basics. Good sleep, good nutrition, moving your body every day.
That's good.
And then the last one would be social connection. That social connectedness is really a big stress management tool. And to fall out of touch with people that we typically think of as our circle, our tribe, would only make it harder to deal with situations like this. The difference is we have to maintain those connections while being physically distant right now. Luckily, we have a lot of technology that helps us do it so much more easily than ever before. But it even extends to sort of a community connectedness. I've seen some wonderful trends with communities decorating their sidewalks with chalk or leaving messages for each other on their driveways or posting messages on a neighborhood bulletin board. Any of those things, for kids, it might be with their sports team or their Girl Scout troop. Any of those things that help us maintain those connections and know that we exist with those people that we've always loved and always counted on helps us to deal with stress.
That's good. You mentioned, oh yeah, no, what were we going to say?
I was just going to say, and you may bring it up later, there are a couple of specific strategies that can help if you see your child struggling in a way, or if you yourself are. And so more, rather than the daily practice of stress management, when your stress peaks, there are a couple of just little strategies that I think can be useful day to day.
Oh, you mentioned screen time a couple of times, and certainly that hits a nerve with my wife and I. We have 4 kiddos, and we try to we're sticking to routines as much as we can, but that screen time is really tough right now. And we certainly know that there's dangerous levels of screen time, and I'm sure this comes up a lot when you are meeting with families or children. Some advice for parents right now when it comes to screen time.
You know, I also have kids, and just as a parent, it's really easy to see that this is a different circumstance. And I think one of the biggest things we have to do for our own coping and stress management is not to hold to some unrealistic or some standards of perfection. Do this Pinterest parenting where you try and do it just the very best way in the most color-coded and super duper expert way. Most of us are relaxing screen restrictions during this time, and I think that's really appropriate and okay. It's part of how a family gets through a whole lot more hours of the day with a whole lot less access to other things to do. I think some of the guidelines can be similar to what I was saying we would teach teens about media exposure, quality and quantity. So you don't want to relax the standards of what you'd let your kids view or do. So just because they're watching more, they shouldn't be watching stuff that's inappropriate or that you wouldn't typically let them watch. The other thing is it's much better to watch some and then take a break and do something else than to say, well, he's going to watch this many hours. He can just watch it straight through. Take a break, switch up what your brain is doing for a time, but be patient and be graceful with yourself and your kids. You do what you can do and get through.
Yeah. So what would be some little things to look for, to help us notice if we have a child that's really having a difficult time with this?
I think red flags would be a real change in sort of functional behavior, some of the basics of daily functioning. So changes in sleep routines, changes in appetite, or a regression in their developmental functioning. So for example, loss of toileting skills in the kid who had mastered that. The other 2 things would be, it's really based on what you know about your kid's typical functioning, but mood changes or behavior changes that are not characteristic of your child. So for example, in terms of mood, a kid who's more sad or more fearful or more angry or doesn't resolve those feelings in the way he or she typically would, Or behaviorally, a kid who is tantruming more or more irritable or acting out in some way. Those would all be signs that if your child is doing those things in ways that are not characteristic, that you may want to ask for some additional support or help, or tune in and see, is my kid thinking or wondering about something that he or she needs help with?
Yeah, that's good. So, we're only, April is closed, as I say in almost every one of these interviews, and we're at the beginning of April here. We don't know how long this is going to last, but it is daily influx of just information that we are taking on. Should we be concerned about, long-term effects here on children, what we're going through right now?
I think it's a really reasonable thing to wonder about, but also when we do, it's a sign of our own anxiety about this time, because the reality is we would really like to have answers about what comes next and what happens and what the future holds. We really just don't know. In terms of preparing our kids for that or dealing with our concerns for it, we just know the best practice is to set ourselves and our kids up to be as resilient as we possibly can. That's what we can do now. That means doing things like acting to make this together have some positive aspects, meaning shared activities, a feeling of compassion and love and patience together. Some things that are actually good times about this will serve us later to have memories of it that, well, we made the best and we had some good come out of it. The other thing would be to decrease the fear and the anxiety about it by using good communication that's calibrated to our kids' age and individual needs, and by keeping up with those healthy routines and making sure our days are managed as best they can to keep us healthy and stress resistant. The last thing I would say about really setting ourselves up to be as resilient as possible is to focus on the positive. And that may sound Pollyannish. I don't mean that we deny that this is an extraordinary thing that we're going through and that we should be sensible about how we deal with it. But focus on the positive means to reframe it a bit as, rather than thinking of it so much as fearful and anxious and restrictions and limits, to instead think about it as we're all contributing, that if we are following the advice of medical experts and civic leaders, we are a part of getting through this the best we can. That we can contribute to our families and our neighbors and our communities by doing what we need to do to help our community get through this as quickly as possible. And I even have a colleague, Angela Dedman, who talks about using the word hero for some of our littler kids. It's part of being a hero to do the best you can, to be a good citizen, a good family member, a good friend. And that's what we're all trying to pitch in right now. Putting that positive spin on it, I think, helps with the resilience.
Yeah, I really love that. Yeah, let's all be heroes through this. We all have a part to play, whether we have kids or don't have kids. We're all Oklahomans, and we should all try to be a hero to somebody through this, through what we're going through right now. Any final thoughts, Doctor, that you would want, again, those that watching this or listening to this right now to help us through what we're going through?
It may be too specific, but there are a couple of just real specific stress management strategies that people may find helpful when they're, if you have a moment where you're just, I don't know what's going to happen. I'm worried for me. I'm worried for my kids. And it's a couple that are easy to guide our children through too. One is, I call it the 5 senses check-in. A lot of people use it, and it's just really grounding and helpful. And it means checking into your 5 senses one at a time in a really conscious way. It helps you get out of that catastrophic thinking and that not knowing what's going to happen. If you just take a moment to slow down, pay attention to your breathing, and then think, what am I seeing right now? Literally look around the room you're in and label for yourself, what do I see? Then what does it smell like right now? What can I smell? What do I hear going on? Do I hear birds? Do I hear traffic? Do I hear my feet on the carpet? What do I feel? What do I taste? And running through that can help us to get, to just bring down some of that stress response and get a little less anxious. Another that is very basic is just flushing out with fresh air. If you find yourself feeling stuck in a very angsty state, really try, just open the front door, get some fresh air, breathe deeply, walk a path a couple of times, count backwards from 10. But let yourself bring your own stress reaction down a bit. The other one that I use with kids a lot is the what is different, what is the same. So if kids are saying, I don't get to see my friends, I can't go to school, I can't do anything I love doing, there's no more softball, whatever. So you need to acknowledge your kids' feelings and losses. You're right, we are not getting to play with friends right now. But that's a thing that's very different. What are some of the things that are the same? I'm still tucking you in bed each night. We're still having dinner together. The dog still needs to be walked. There are so many things that are the same and that connect our kids and our families to what we do every day. And that can be a good exercise. What's different, but what's the same? Just a couple of ideas.
Yeah, that's really, really good. And I don't know how much this session would have cost the normal person, but thank you for providing these resources for free to Oklahomans. It really, really helpful. And again, Oklahoma, and as you know this, we know this as Oklahomans is not a stranger to crisis. We go through a lot of these. This is unprecedented, but Oklahoma, I truly believe, is going to bounce back quicker than other states because that Oklahoma standard usually always shines through, and we've been through crises before. And I think we're resilient and we'll get through this. But things that you shared today, I think, are just really invaluable to families right now. So cannot thank you enough for coming on and doing this interview with us.
Well, I appreciate you inviting me so much, and appreciate that you're doing these segments and trying to serve the state as we try to come through all of this. I agree. We'll get through this. It's a very tough time. All we can do is be the most responsible we can be, and work together. Thank you so much for inviting me. It's very nice to speak with you.
Absolutely. Thank you, Doctor. We will be back with another episode very soon. Thanks, guys.